So started the timer and here is your question. Right. So if you have read and understood, considering it history taking station, kindly begin.
Okay. Hello, I'm Dr. Samreen. May I please confirm your name and age, please?
My name, Mr. Mann. My
Okay.
age may be 67 years.
Okay. Nice to meet you, Mr. Man. So, I have some questions regarding your symptom. Can we proceed?
I don't know, doctor.
Okay. Just bear with me. And can you tell me, in your past days during your hospital stay, have you been feeling very depressed or hopeless?
Yes, doctor, I don't like anything. I don't want to do anything.
Okay, I'm so sorry to hear that. But I think if you can just talk to me a little bit more, then we can help you. Okay?
I don't know, doctor.
Okay. So just can you tell me, do you find little pleasure in life and have you been feeling overly tired?
I'm always tired. I
Oh, I'm
don't
so sorry
find any
to.
pleasure.
Okay, I'm so sorry to hear that. And can you tell me about your sleep pattern? Has this changed recently?
I don't know, actually. I'm confused. Maybe I wake up early and I
Okay.
find it difficult to go back to sleep.
Okay, that must be quite miserable for you. And do you have difficulty in getting sleep at all?
I get sleep sometimes, but it's disturbed.
Okay. And what do you think? Does your mood varies throughout the day?
Yes, doctor.
Okay. And is there any particular time when you feel that your mood is too bad or worse?
Well,
Hello?
You can hardly hear
Not
you.
throughout the day, my mood vary.
Okay.
Hmm?
Okay. So do you think that your mood is gradually worsens as the day passes?
Yeah, doctor, I think so.
Okay. So just can you tell me a little bit more about how is your appetite been recently?
I don't like to eat anything.
And can you just tell me what do you like to eat at the moment? What is your diet is?
I eat the normal, regular food, but I don't like that.
I'm so sorry, but you must need to have the food. I'm going to ask you some more personal questions. Like, is that okay with you?
Yes, doctor, you can ask.
Okay. So, do you think since you have been feeling very uh, low these days, so do you have any change in your sex drive?
Yeah, I have lost my libido.
Okay, I'm so sorry. And do you think has this ever had? Do you experience this for the first time, or you had this kind of problem before as well?
I'm having this problem since last 10 years, more than 10
O-
years.
Okay, I'm so sorry. And for that,
I have
have
lots
you?
of medical problem. I take lots of drug. I don't feel good.
Okay, I'm so sorry. And for, do you have in the past any mental health problem?
As long as I remember, I don't feel good.
Okay,
I'm
and have you
repeatedly
been?
coming to the hospital for this problem.
I'm so sorry.
This
I'm
is my
really
fourth
sorry to.
visit.
I'm so sorry to hear that. Have you had any counseling for this issue?
Yeah, I'm taking the treatment.
Okay, can you tell
I
me?
have come to you
Any,
already for it is the fourth time.
I'm so sorry. Yes, we can see that. And have you been hospitalized for your mental health?
No, doctor, I'm not hospitalized.
Okay. Okay. As you said, you are taking medications. Can you name the drugs that you are taking?
The
The
doctor gave
medication.
me some drug for my blood pressure and diabetes and what you call, I don't know, hypercholesterolemia. What does that mean? I take
Okay.
lots of drugs. Sorry, I can't tell the names.
Okay. That's okay. No problem. Are you allergic to any drug
Any
or
medication?
any food,
Oh,
any medications?
no, doctor.
Okay. And any of your family member has similar kind of problem?
No, they're all
Okay.
healthy.
Okay. Can you just tell me what do you do for living?
I do nothing for living. I just live at my home.
Okay. And who stays with you at home?
My grandchildren.
Okay, can you
Okay.
summarize your history now, please?
My patient, 67-year-old,
Yes.
presented with a decrease in mood and feeling hopeless during his past days in the hospital, and change in appetite and change in libido as well,
Yes.
and has a decreased has a disturbed sleeping pattern. So my main differential diagnosis would be a recurrent case of depression,
Okay.
and
And what are your differential diagnosis?
Uh, this could be uh, this could be also reactive depression, since the patient is taking a lot of medications for other conditions.
Okay. How do you think of managing this patient?
I will manage the patient according to the severity, and
Okay.
if it is a mild case, then I'll advise the patient to have regular exercise, advice on the sleeping pattern, and also give psychosocial therapy, that is cognitive behavioral therapy. And if it is moderate case, then I will advise on the regular exercise and sleep pattern along with the cognitive behavior and therapy. Also will give medications, that is SSRI. And if the patient becomes violent to others and also harmful to herself, then we'll admit the patient to the psychiatric ward after using the Mental Health Act if necessary.
Define the mental health act, please. And what
Um,
does it include?
uh, Pass. Oh, I'll get back to this later.
Okay. If patient does not respond to the medications, what next would you do, or who would you involve in the management of the patient?
I will involve the psychologist and also the psychiatric consultant and social workers as well.
Okay, good. Thank you. Nice.
Okay.
It was good. The only
Okay.
problem I felt that you were using the word drug when by all means you should use the word medication or medicines,
Okay.
right? It's
Okay,
because
ma'am.
drugs are the substance of abuse. Good.
Okay, ma'am.
Thanks.
Okay. Ma'am, do we ask all the eyes and eyes
In
questions to
this one,
this?
you'll only do the mini mental test because here patient will not be even responding. How,
Yeah.
okay, just suppose in real exam, you get the patient because in this one patient
Yeah.
will be post gastrectomy, post-op
Yes.
patient. And if patient is not willing to respond, how would you make the patient turn to you and answer your question? This will be a dilemma because in real life, patient will not be cooperative like your friend.
Yes.
So
I
if in
also
real
heard that.
life, yes. So in real life, what would you do? What actions would you do, or what things you can keep in your mind? What would you do to make patient listen to you and talk to you or cooperate with you?
Um, I'll um try to counsel her and mm,
Him
try
or her?
try
Okay.
to
Yes.
I'll try to ask her or him the questions regarding the depression
No, you'll
questions
not
only.
directly
No.
because patient will not have the insight that patient has depression because patient is
Okay.
post-operative. So you'll ask,
Yes.
how are you feeling now? In
Okay.
this was my question for today, right? But in
Yes.
exam, the question or the stem that normally comes, it's the patient is post-operatively
Post-op.
hospitalized, and then patient is feeling depressed because of chronic, prolonged chronic illness because of the
Yes.
bladder cancer, right? So there
Yes.
you'll ask about the so so you'll ask about the condition. How are you feeling now? Do you remember when you were operated? Can you recall? So you'll make the patient talk by very politely and nicely by asking other things, so that patient will
Okay.
forget that patient was depressed because patient the psychiatric patients don't have insight. They will not tell you that I'm depressed. Here, okay,
Okay.
your friend was cooperative. She was telling you we are just role playing and trying to learn. But in the real life, patient will not tell you that patient is depressed. Will just say, no, I don't feel like doing anything. I feel low all the time. I have the low mood all the time. And you will interpret that this is depression. And
Okay.
here you will not take the, okay, you'll take the past history, but here you'll not ask for the past medical history or the past surgical history. Even the age you'll not ask because patient is hospitalized. And here
Yes.
you'll call the patient with the name, Mr.
Name.
Matthew or Mr. Smith or whatever, and you'll confirm, let's confirm that you are still 67 years old. So like this, you'll make sure that the confirm the age of the patient, because if there is patient who comes in outdoor, then you confirm the age. But if patient is admitted, then patient you will confirm the age from the band of the on the hand of the patient,
Yeah.
right?
Okay, ma'am. Yes,
Because
ma'am.
this is patient is already admitted, and then you'll not
Admitted.
ask
Yes.
the drug history or the family history or eyes or
Or
anything.
anything else.
No,
Right.
you'll not ask those because
Okay.
it is not that kind of history taking patient. Good.
Okay, I
Okay,
have
ma'am.
one
Yes.
question for
Yes.
this patient. If after doing all these things, patient is not willing to talk with me,
Yes.
then can I ask him if he need anyone from his family with him?
You can ask, are you missing someone from your family? Do you want them to be beside you?
Yeah, can I tell that?
Would that give you support? Would you want me
Okay.
to arrange someone from your family or your loved one uh, to be with you here? Are you feeling lonely? Are you feeling whatever? Like you have to make the patient talk to you. So you'll use all the strategies, all the emotional things that you can. But you can't directly ask, are you feeling depressed? No one would tell you that they are feeling depressed. Even the normal patients, they sometimes they feel low after operation, but they won't tell you that they're feeling
They
depressed.
won't tell.
No. Good.
So we have to change our question pattern.
You have to change your
Yes.
strategy. Yes. This
Thank
is, and
you.
this is the technique that you apply on the day of the exam that matters. And that's why we are discussing this, so that you'll keep in your mind. And when the situation comes, when patient is rude, does not respond, it's just like a brick wall, does not even respond, does not give you any impression or expression or any emotions, then how would you melt that ice? This is what you have to learn. Good.
Okay.
Yes. Okay.
Thank you.
Thank you, ma'am.
Thank you.